All right, so here's the second of our two presentations. So we're going to be looking at the lower extremity now. Again, remember appendicular simply refers to, we're talking the appendages, we're talking the arms and the legs, we're talking everything other than the axial skeleton. Now, first and foremost, when we talk the pectoral girdle for the upper, now we're dealing with the pelvic girdle with the lower. So again, we start at the proximal end and we work our way to the distal. Now, the hip, the thing you want to recognize about the hip is we have two different coxa, two different hip bones, and each coxa consists of three fused bones. Okay? We have the ilium, the ischium, and the pubis. Now, the other thing you want to remember is the purpose. Remember that these provide slight protection in the pelvic region. So remember we have the abdominal pelvic cavity. The wall on the anterior side is strictly musculature, and then we have the support of the hips. Also remember that the weight from the vertebrae, the weight of our axial skeleton is transferred through the vertebrae. So by the time we hit the lumbar vertebrae, they're very, very large, the bodies are, so that weight can be transferred to the sacrum, which is then fused with the coxa, with our hips, and that's where we see that weight being transferred from the torso into the legs. Okay? Now, we know we have three fused bones, the ilium, the ischium, and the pubis. The coxa is one of the major bones you have to know all the key features for. So I'm not going to spend a lot of time looking at the features here, so much as spending a little time with the actual diagram. All right, so you can see that they articulate with the hip. In other words, where they articulate is what's known as the acetabulum or acetabulum. I always said acetabulum, and apparently it's acetabulum. In any case, that's the articulation point where the coxa articulates with the femur. All right. Now, other portions, you have the ischium and the pubis bone. The pubis. Now, the ischium is what we sit on when we sit down, and it's that L portion of the hip. So now, when we look at this, you can see down here, back here, this portion right here. Okay, that's the ischium. Here's the pubis, and all of this is the ilium. Now, the acetabulum, which you can't see in this view, is this space right here. This right here is my acetabulum. And that's simply the articulation point of the hips with the femur. Now, when we look at the pubic bone, again, the pubis is two fused bones joined by the pubis symphysis. That's this area here. The pubic symphysis, this is what in women will pop apart and then it pops back together during childbirth. And that's to expand this area here. And we'll talk about male versus female anatomy in just a sec. Okay, in terms of the pelvis. Okay, first and foremost, when we look at some of the key features, the iliac crest, obvious. Okay, you can see the sacroiliac joint. So sacrum, ilium, sacroiliac. The other thing is this right here, this point here, is the front portion. This is what's known as the anterior, so right here, this is the anterior superior iliac spine. Okay. Okay. And on the back side, you have a posterior superior iliac spine. So it's just that point where it comes around. Okay. And it's actually, if you could see through it, it would be right about here in terms of the back side, the posterior side. Okay, so we have the anterior superior iliac spine. Okay, we have on the inside this area that comes down here to this part right here is known as the arcuate line. Okay. Whoops, that's supposed to be a U. Arcuate line. Okay. The acetabulum, we've already talked about. You have the pubis and you have the symphysis. Okay, this area where we see the pubic symphysis forming between, okay, this is known as the pubic tubercle. And remember, a tubercle is simply a process of projection from the bone. We also have what's known as the ischial tuberosity, and that's on the back side. Okay, so it's on the posterior side, ischial, and and that's a CH, guys, ischium, ischial tuberosity. Okay. This area coming down, this area, this kind of flattened region of the ischium, okay, is known as the ischial ramus. Ischial, whoops, come on, C. Ischial, that's supposed to be, all right. Ramus. Okay, wow, that was bad. Let's try this. R-A-M-U-S. Okay, that looks a little better. All right, so we have the ischial ramus. Okay, now this area, okay, right here, okay, this is the obturator. Oh, T-U-R, just the way it sounds. Obturator. Foramen. Okay, that's that big hole here, the obturator foramen. Okay, then we have we've got the acetabulum, we have, oh yeah, that's right, this area at the back right here, okay, that's known as the greater sciatic notch. Okay, so that's your greater sciatic notch. And we got the anterior superior iliac spine. We have, oh yeah, the anterior inferior iliac spine. So this is the anterior superior. This down here is the anterior inferior iliac spine. Okay. And then what we really care about is so those are the major features you have to know for the coxa. Now, what we also care about as we come into the male and female pelvis is you want to recognize a couple of differences. The false pelvis is what we call basically from the iliac spine to iliac spine. Okay, so that's my false pelvis. Notice in men and women the difference in the false pelvis. You can see, if we were to connect these right here, you can see a much more flattened, ovular, shall we say, oval-shaped false pelvis. Here, if we connect these guys, it's less so, it's more round. It's not quite as flattened in this direction. So this makes the false pelvis much wider. This is kind of important when we're looking at the purpose of male versus female. So obviously females, we have to fit stuff through, males don't, okay? Now, the other thing that's interesting that you can't really tell on this diagram as well between male and female is you can see how the coccyx here seems to come in, but when you actually look from the side, the coccyx and the sacrum actually comes in more on males. So if you look at this from a lateral view, you can actually see the coccyx and the coccyx and the sacrum coming literally more to the anterior portion of it, whereas females, it's almost slightly more upright. Okay, you see it less anterior facing, which is kind of important if we have to have babies pass through our pelvic brim. Okay, our true pelvis. So that's going to be another difference here when we look at the sacrum and the coccyx. The other thing is the pubic arch, or what's also known, this is also known as the Q angle. And we talked a little bit about this in class because it does play a role in how the femur exits from the pelvis and actually comes down into the knee and forms our knee joint, because it tends to make women more susceptible to ACL injuries than males. Okay, let's see. So we've got the Q angle, we've got the false pelvis, the true pelvis, we've got the pelvic brim. That's pretty much it. So here when we talk Q angle, less than 90, greater than 90, yeah, that's pretty much it. So make sure you know the differences between the anatomical differences between male and female. All right, so that brings us to the femur. Again, the nice thing about the femur is it gives you all the key features that you have to know. We have the lesser trochanter, we have the greater trochanter, we have the intertrochanteric crest, so inter between the trochanters, okay? You have the gluteal tuberosity, we have the intertrochanteric line. Now notice the intertrochanteric line, okay, is on the, when you look at this, we're looking at the anterior surface here, and this is the posterior view, okay? So the trochanteric line is on the anterior, the trochanteric crest is on the posterior. So that's just a way to kind of keep that in mind. Now, this line here, you can even see it in this. This is what's known as the linea aspera, A-S-P-E-R-A, okay? The linea aspera. You already have to know the lateral condyle, the medial condyle, the lateral epicondyle, medial epicondyle. Remember, epi refers to the outside, so that's my medial condyle. Okay, here's my epicondyle, my medial epicondyle, lateral epicondyles, okay, lateral condyle, medial condyle, and then the patellar surface. Now, the only thing I want to point out is this here where it talks about the intercondylar fascia, and that's kind of important because that's there's an area on the tibia that kind of sticks into that space, and that's why we have that fascia. Other things, when you look at this, you can really tell when the femur is lifted up into a horizontal position. The patellar surface here is real important and very, very smooth. And that's kind of important when we look at the patella. So again, we have the apex, the base. Okay, the apex is the point. Okay, and you can see how this is going to articulate on the surface here of the femur. Okay, so it's the sesamoid bone. Remember, that's just a type of short bone. All right, now, when we look at the tibia and the fibula, what's important and interesting to recognize is that the tibia is the primary weight-bearing bone. Notice that the femur does not articulate with the fibula at all, okay? Now, that top portion, okay, this is what's known as that intercondylar eminence right here. The intercondylar eminence right there is what fits into the intercondylar fascia of the femur, okay? Now, you can notice that the head of the fibula is attached, articulates right here with the tibia. We have an interosseous membrane here, just like we saw with the ulna and the radius, except this one is less mobile. And then we come down here, and what we really care about is recognizing medial malleolus and lateral malleolus. The malleoli are what comprise your ankle bones. So when you talk about your ankles and you can feel the ankle bones, what you're actually feeling are these extensions of the fibula and the tibia. Okay, so again, fibula, key points, head, lateral malleolus. All right, so when we come down here into the foot, again, we see tarsals, just like we saw with the carpals. You do need to know the tarsals. The most famous tarsals, or the ones that are easiest to remember usually, are the calcaneus, and the talus is what articulates up here in this area. The talus fits into this area with the tibia and the fibula. The talus, if you ever hear about the mortise joint, this is what you're referring to. You lock your mortise. This is real important in terms of soccer, because when you lock the mortise, you raise those toes and you kick. That's what helps to stabilize the ankle and keep the ankle from flopping back and forth. Okay. Then you also need to know the cuneiforms, obviously. You can see we have a medial cuneiform, intermediate cuneiform, lateral cuneiform. Here's my cuboid. Okay. The navicular is right here. The talus is this, by the way, this is an extension of the talus. And then you have the calcaneus, okay? Now, the metatarsals do much the same thing. They look like tiny little long bones. You can see that the phalanges, okay, the phalanges have similar distal, middle, proximal. The metatarsals here, it's just that part that determines the foot. And again, the proximal, middle, distal, except for the big toe, which just has proximal and distal, just like we see on the hand. Now, one of the things that we care about the most in terms of the bones are the arches. And we have 3 key arches. This is partly why there's such a push to run barefoot or to go barefoot as much as you can. You get a better spring in your arch, and it also prevents you from doing as much of the calcaneal hitting, landing that heel strike. Heel striking is actually not how we're meant to run. We are actually meant to land flat-footed. Yes?
You have it, don't call at the front desk.
Okay.
In any case, this is why it's better for us to run, because we are made to have a flat foot, not a heel strike.